Hi, Dr. Weiner. I am in the beginning stages of weight loss surgery, and so I'm actually at the point of trying to figure out which one to choose. So, whether to choose the gastric bypass or the sleeve. And so, I did find your videos on YouTube, and so I've been binge watching them a lot. But my main question is just that, which one should I go with? My main concerns are just trying to make sure that I choose the one that will set me up for long-term overall health. And so, I definitely want to lose weight. I'm currently at 310 pounds, and I'm 5 foot, so I definitely need to lose at least 150 pounds, definitely more probably. And so, but at the same time, I want to make sure that I'm healthy overall, even if I lose the amount of weight needed to get into a good BMI. Currently, my BMI is 60, and I think I need to be at 20. But yeah, so which one would you recommend for me? Okay, thank you.
So deciding on which surgery you're going to have is really one of the most critical parts of your preoperative process. And this is something I work through in the office with people, 8, 10, 12 times a week. There are some times when the decision is pretty clear. For instance, if someone has very severe heartburn, I really wouldn't encourage them from having a sleeve gastrectomy because of the risk of heartburn afterward. If someone is dependent on high doses of Advil or Aleve or other NSAIDs or aspirin, or perhaps has had lots of surgery in their abdomen, not just gallbladders, but big hernias or colon resections or things like that, I really wouldn't recommend a gastric bypass in those patients. And I'd say about 25% of the time, I say, yeah, this is not a surgery that you can have. You can't have a sleeve or you can't have a gastric bypass. You really only have one choice here. So that's relatively uncommon. What we find is generally that this becomes a value decision. So with a sleeve gastrectomy, we have this really safe surgery that just doesn't change things that much. It's not going to change the way you digest food. It doesn't reroute your intestines. We see heartburn after the surgery, but we don't really see a lot of other abdominal problems. So we're just not creating as much change. There's less consequences of a sleeve gastrectomy compared to a gastric bypass. But as a weight loss tool, it is less effective. You lose less weight with a sleeve, and it's harder to maintain that weight loss compared to a gastric bypass. A gastric bypass is more involved, more consequences, more surgery, a little bit more risk, but it works better for weight loss. So on one hand, we have a really safe surgery that doesn't quite work as well. So if safety is your number one priority, and of course everyone wants safety, and generally both surgeries are very safe, but if this is your single most important thing, and if you regain some weight but choose a safer option, you're fine with that, then you choose a sleeve. If you're willing to accept a little bit of risk in exchange for better weight loss and better durability of that weight loss, then a gastric bypass is a better choice for you. This comes down to what you value the most, what's most important to you as an individual. Now, as a side note for this individual patient, they're 5 foot tall, 300 pounds, they're going to be a higher BMI. In general, once your BMI starts getting 50 and higher, I generally lean much more toward a gastric bypass. Doesn't mean I won't do a sleeve on patients with a BMI over 50. It's just that typically we're going to see inadequate weight loss and some weight regain down the road. Your BMI is 35, 40, low 40s, a sleeve is a better option in that BMI category. So if I was counseling this patient, I certainly would be encouraging them to pursue a gastric bypass, but I'd make sure they understood the differences between these two surgeries and the decision you're actually making about what's most important to you.